My name's Doug Pensay. I'm a radiology doctor at University College Hospital, and I also work as a research doctor at University College London, where I work in the Centre of Medical Imaging. My research interest relates to abdominal MRI, particularly looking at new ways for imaging cancer. The liver is a complex and fascinating organ. It sits at the heart of our digestive system and plays a key role in metabolism, being part of the synthesis of proteins, of lipids and of clotting factors. It's important for our immune system and is important for all parts of our glucose metabolism, including glucose storage. It's a unique organ in that it's got a dual blood supply. Blood coming directly from the gut full of nutrients flows directly through the liver, as well as oxygenated blood coming from the arterial supply from the heart. This complex, fascinating organ poses a real challenge to us in cancer imaging. The liver is one of the most commonly affected organs from cancer. Bowel cancers and others often spread to the liver and poses a real challenge to us when we're detecting and monitoring patients with disease. The dual blood supply and the motion caused by breathing makes imaging of the liver particularly challenging. Despite some breakthroughs in MRI contrast agents over the last few years, the mainstay of clinical imaging for patients with cancer has not changed in the last 10 years, relying on CT scans with injections of iodine-based contrast agents. There's a real clinical need for new MRI techniques which can describe in detail the physiology and the biology of liver. I'd like to introduce you to my colleague Simon Walker-Samuel, who will tell you more about the specific techniques and the detail of the project.
My name's Simon Walker-Samuel. I'm a physicist by training and I work at the UCL Centre for Advanced Biomedical Imaging, or CABI for short. The main aim of my group is to develop novel methods for imaging cancers, particularly in the liver. And one of the main techniques we've been working on is arterial spin labelling. Now, hASL, as it's known, is a method which we can use the water within the blood as a marker of perfusion or blood flow into each tissue. We're one of the first to use hASL to evaluate blood flow in the liver, and we want our PhD student to work on developing this technique further to build on the work that we've already done. So my group is working with clinicians like Doug Pensay to take our experimental technique, which we've developed on our high-field scanners at CABI, and implement them on the clinical systems within the hospital. UCL is unique in its provision of imaging modalities, both in the clinical context at the hospital, but also in the experimental context. So at CABI we have 8 in vivo imaging technologies. We have 2 MRI systems, PET, SPECT, CT, ultrasound and bioluminescence, all of which can be combined together to develop the next generation of imaging techniques.